Hello, everyone. Thank you for being here with us today. So I'm Denise Giambalvo, Director of Member Engagement and Business Strategy at Washington Health Alliance. And I will be providing a bit of an overview today and facilitating a discussion. Let's go to our next slide. You're all on mute, but we want this to be interactive. So when we get to our discussion portion, if you would rather come off mute to speak, opposed to entering comments in the chat or the questions you have in Q&A, you can do a hand raise and we can take you off of mute. So yeah, so you can let us know that. And then you will receive slides from today and a recording of this session. Next. We have Dr. Shana Mancuso here with us today to talk about the symptoms, prevalence, and financial impact to employers when they have women at the life stage, the menopausal life stage, and how, how their productivity can be impacted through side effects and other experiences with menopause. So let's go next. And Teresa, we're seeing your email. Thanks. So we have many of our members on today and so happy to see all of you here, but some of you who are not members, we encourage you to consider membership with us. And we have a lot of exciting things going on within the Alliance. On the left, you can see that the purchasers are in kind of a bigger bubble, and they overlap with many stakeholders. And that's the perspective that we take here. We're acting based on what's in the best interest of purchasers and their membership. And by shifting that focus a bit for us, we're finding that our discussions are different. So we put out our community checkup every year, right? And then there's other reports that we may release also. Just in the fall, we did our health waste calculator with the area deprivation index. So you're able to look at where waste is in the system and is there disproportionate impact to those who are more disadvantaged versus those who are not. We lead discussions, right? We create value by bringing all the stakeholders together to have important conversations, to share information, to learn together. But that doesn't necessarily lead to action. And that's where the driving the market change is. It's not just that we highlight the results, it's that we make recommendations on actions that can be taken, and we facilitate discussions on that. And what we're seeing is that behaviors are changing. So providers are acting on the community checkup reports to improve quality, close gaps in disadvantaged communities, and reduce wasteful services. So that's exciting. We're finding purchasers are using what they learn at the Alliance to question their data, to question their vendors in a different manner, to change benefit design to better serve their entire population, right? So that's that equity look, right? And then they're not just questioning partners differently, but they're also in some cases choosing different partners. who are going to ensure that they're meeting their fiduciary responsibilities. And then, another primary stakeholder in this is the payers. And we have payers or health plans, however you'd like to refer to them, collaborating to create a standard outcomes-based measure set for behavioral health. There is no such set that exists anywhere in the country. So we're very excited to be bringing payers together in Washington to have this conversation, along with a subject matter expert, Blueprint Health, who has significant amount of data measuring outcomes within behavioral health. So some exciting things going on here. If you're not a part of it, this is the time to join us. We're truly at an inflection point where we can make a difference in Washington State. Next slide. And so plugging into us, how do you do this? Members and non-members can participate, attend our May 15th forum on pharmacy benefits, and or our June 6th, where we're going to be asking, if you send more, does that mean you get better? And it may in some cases, right? And in others, not so much. So we'll be taking a look at that. And those are 2 in-person events in downtown Seattle. We will have a live stream option. Our preference is to have everyone together. It's been far too long. We brought some people together last year. We'd like to see a much bigger crowd this year. That's how we get those side discussions going on, right? And real brainstorming and learning in the moment. And then as members, we have our Roadmap to Equity work group. So that's a work group we pulled together. It was by invite only. That continues. And we're releasing our report on hospital price transparency in June at that event. So we're working on that right now, our data analytics team. And then, of course, we continue to have our committees on quality improvement, health economics, and our purchasers meet together, just them, no other outsiders, to learn together and share information, and be able to discuss things that perhaps they don't feel as comfortable discussing with others in the room. Next. Oh, thank you. You're good with that, because I did want to. You just reminded me, Teresa, that we have 2 polls to do. So there's 2 questions that I'm interested in learning from you. Meant to do one 2 minutes ago. So first is, right, where does addressing menopause in the workplace fall in your organization's list of priorities? So you're all here for a reason, right? This topic is of interest to you. How important is it to your organization? Lisa, can you show the results as they come in? Is that possible? Or yeah, wonderful. Okay. All right, good to know. Majority not currently a priority. Maybe we change that by the end of this program. So okay. So then the second question is, what is the approximate cost burden for workdays missed in the US each year due to menopause symptoms? What do you think that is? I'm pretty sure it's a drop-down menu for you. 1.8 billion is what most of you think. Half of you are falling in that. We're going to give the answer a little bit later. Well, thanks for playing with us. little activity early on. We'll have some more for you to do as the program progresses. But I'd like to introduce all of you to Dr. Shana Mancuso. She's a board certified OB/GYN and medical director in women's health at Astellas Global Pharma. She's been with Astellas for 3 years, and prior to that, she served as medical director of women's health at AbbVie. Dr. Mancuso continues to see gynecological patients in a multi-specialty practice, which she established and served as medical director in Chicago. Dr. Mancuso. Be able to come off mute and be on camera? Oh, okay. I'm seeing an email right now. Dr. Mancuso's computer shut down on her and she's in the process of rebooting. So she's not in the room right now. So we're
I actually had her, Denise. She was logged in as Melissa, and then we lost her mic.
Hi, everyone.
There we go. Thank you,
Oh,
Dr.
okay.
Mancuso, for your persistence.
I that I have. I might not have other things, but definitely that. Yes, we tried a few. I was logged in, but we tried a few different ways. So we are good. I apologize to everyone for the delay, but we are good to go. And are you going to move my slides, Teresa?
I sure am.
Okay, awesome. Hi, everyone. Time to let me switch gears here. And so just want to say thank you so much for being here today. And I'm very grateful for the opportunity to speak with all of you. And I do want to take one moment and just tell you that I appreciate the work you're doing, and you are working to drive change in healthcare and healthcare benefits, which is not an easy task, as we know. It is not for the weak, and you are looking to drive change for not only some of your organizations, but your employees and your families, I'll say as well. So thank you so much for letting me be here and to talk to you a little bit about women's health at midlife and supporting women and individuals through the health journey. I have been a practicing OB/GYN for just over 20 years post-residency. And as you heard, I joined industry just about 3.5 to 4 years ago, and to have a small patient panel on the weekends in downtown Chicago. But through my, I'd say my 20 years of experience, and maybe when I was a resident as well, I've seen great progress, I think, as we all have, from regarding employer support and policy change within women's health, but mainly within the fertility space, which took a while and is quite solid now, and within maternity, postpartum, but really menopause and midlife women's health has remained a bit of a healthcare desert when it comes to those topics. And I think that's not exactly surprising, right? Because it really hasn't been talked about much until now. We know menopause is having a bit of a moment now, but we weren't talking about it with friends, socially. No one was talking about it even with their physicians, NPs, PAs, let alone in the work setting. And this came just from the not only perhaps fear of ageism, but the stigma that we all know that has been surrounding that menopause life stage. So I think we really all of us have a true opportunity here to move the needle in an area that is affecting over half of the global workforce. And let's kind of work together and see what we can do here. So one moment, sorry, my screen just, there we go. And today we're going to dive into menopause a little bit more and midlife women's health. And I'm going to start at the very beginning and just briefly kind of go through what is it, who does it affect, and how does it impact them, and then dive into how it impacts work productivity and economic impact from there. Teresa, do you want to go ahead and advance the slides, please? Perfect. Okay. So natural menopause is normal, right? It's a normal physiologic event that we know results in symptoms for not all women, but a vast majority. And we all know someone who is in menopause, has gone through menopause, is going through the menopause transition, be it a partner, a mom, a grandma, a sister, ourselves. And so it affects all of us, okay? Let's level set there really before we start anything else. And as we know, it's defined as the permanent cessation of periods of a menses due to that loss of ovarian follicular function. And the average age of onset of menopause is 51 years, but that can range from 40 years of age up to 58 within the United States. And I want you to think about that for a moment, that 51 years, that average age, and think of it in the work setting. And that is really kind of the point in time, the point in life where many women, many individuals are just at the peak of their career and kind of advancing into new leadership positions, or there's also a subset and a group that have really started to reprioritize work at that stage of life, and it's kind of moved to the front as children perhaps are getting a little bit older, and that is the point right when symptoms hit. So it definitely affects many aspects of life, and definitely including their work. And more than 1 million women in the US enter menopause each year. So also, if we think about this for a minute, the overall life expectancy is 81, excuse me, in the United States. And so that shows us, that tells us that women spend up to 40% of their lives in this post-menopause life phase. And really, as we know, that's a substantial amount of time spent in this life phase. So essential that not only healthcare providers, but all of us really kind of take note of this, take it seriously, and prioritize it. Teresa, do you want to advance the slide, please? Thank you. Okay, so when we dive in a little bit more into who do the menopause symptoms and menopause in general really affect, and how does it affect them? So we know that menopause does result, as I said, in burdensome or bothersome, we'll say sometimes, of course, symptoms for most women. It does affect them. And Black and Hispanic women experience menopause 2 to 4 years longer than white and Asian women. And this is super important, so I'm gonna expand more on this in a large study that was done on the subsequent slides. But we also know that 73% of women are not treating their menopause symptoms. And this is multifactorial on why this is occurring, but it's occurring, and it is substantially referenced in the scientific literature. And 80% of women in the US experience hot flashes with an average duration of 10 years. But let's kind of zoom in on that aspect a little bit more, on the duration of this particular symptom. Next slide, please. So we know there are a multitude of symptoms associated with menopause, and we also know that the most common and bothersome of this collection of symptoms are hot flashes and night sweats, otherwise known as vasomotor symptoms or VMS. Okay, and I want to kind of discuss a few findings from a very well-known study. This is the study of women's health across the nation, or the SWAN study, and this was a multiracial, multi-ethnic, it is observational study, and really the aim has been examining not only biological but also psychosocial changes that occurred during that menopause transition. And it started in 1996 and enrolled over 3,300 women at 7 geodiverse sites across the United States. And this study revealed to us that frequent vasomotor symptoms, or VMS, for all women was 7.4 years. But the aspect that SWAN really hit home for us and highlighted, and it really needed to be highlighted, was the fact that this duration of VMS varies significantly according to one's race and or ethnicity. So as you look over to the right, the median duration of frequent VMS by race and ethnicity, and Black women, look at the duration of their vasomotor symptoms. So we know that average, like I said, is okay, fine, 7.4 years, but Black women can experience these symptoms up to 10.1 years, followed by Hispanic women, and then you see white women at about 6.5. And then the study specifically looked at within the Asian population, specifically Chinese and Japanese, as listed there. So very important to understand this and not only communicate with patients, individuals, people that we work with, live with, but also my colleagues, healthcare providers, really need to understand this and prioritize patients accordingly. Also, we know that the prevalence of symptoms in Black and Hispanic women is also higher. They have a higher prevalence than Caucasian and Chinese or Japanese women. Next slide, please. Okay, so a couple things. As I said, there are many symptoms associated with menopause in general, right? Everything from skin and hair changes, weight gain, especially around the waist, and increased waist circumference or abdominal circumference, sleep changes or disturbances, cognitive changes, and vasomotor symptoms, or VMS. And again, they are the most common and bothersome symptoms. So when we look here, I really like the slide because it's simple, but it does highlight some key factors here that those core symptoms, some of them that I just mentioned, there are others, and vasomotor symptoms really do have a negative impact on health, physical health, quality life, and economic outcomes. And I not only see this clinically with patients, but there is a plethora of research supporting this, and it is ongoing and continuous with some really top international experts right now. So impacts on physical health, I'm going to touch on a few of these because I think they're really important, and we could have a whole talk just on these, but I know where you all want to get, and that's on the next slides coming up. But important to know with physical health, they have an impact on of course, bone loss and fracture, epigenetic aging, and cardiovascular disease. So we know that individuals with vasomotor symptoms are shown to have an unfavorable cardiovascular risk profile. And there is a large body of evidence that's coming out from two big experts that some of you might know of, Dr. Mackey and Dr. Thurston, in their Ms. Brain and Ms. Health. And they're really showing that VMS has an impact on cerebral vascular health. And again, like I said, different elements of cardiovascular health and disease. Also an impact on mental health and sleep impairment, sleep disturbances, and mood disturbances as listed there. And this is a bit of a complex and bidirectional, as we call it, association between these hot flashes and night sweats, mood disturbances, and sleep. So it is complex, but we do know, and it is very supported, that menopause is a vulnerable period for women, for individuals, for depressive symptoms and anxiety. And the odds of one experiencing depressive symptoms or anxiety increased within the menopausal transition. And definitely saw overall impacts on quality of life, of course, and interpersonal relationships, and economic burden as well. The literature shows that vasomotor symptoms may contribute, and other core symptoms may contribute negatively to work productivity and healthcare resource utilization as well. So let's go to the next slide, please, Teresa, because this is just a little bit of a double click on one aspect that I just mentioned, which we know affects so many women and individual in this life stage. And approximately, this is pretty staggering statistics too, but very, very right on with what we see in the real world as well. But 40 to 60% of women report sleep disturbance during the menopause transition. And I know some of you can relate to that either personally or with partners or friends. And again, looking at the data from the SWAN study that I had mentioned, it showed that as severity of the hot flashes increased, right? So as severity of these vasomotor, as severity of the vasomotor symptoms increased, that you see to the right on that table, the prevalence of insomnia increased as well. And VMS has been strongly associated with poor sleep continuity, definitely quality. But remember, this includes what we always hear about: trouble falling asleep or trouble staying asleep. So waking up, midway through the night, or waking up very early in the morning, say often 4:30 in the morning, and greater motor restless in bed and less efficient sleep. Let's go to the next slide, please. All right, so I want to transition into what I know is also very important to all of you, and you want to hear the impact on the workforce and economic consequences. So what is really going on here? What does the literature show? What are we seeing? And I want to break down a few aspects for you. So the first two boxes, the statistics in the first two boxes are from a recently published study out of the Mayo Clinics. And I'm going to expand on this study because it's really exciting, actually, and progressive study. And I'll expand it on the next couple slides. But this was a staggering statistic, and I had to pull it out and put it up here for you to see. But they discovered that lost work days due to menopause symptoms resulted in a cost burden of approximately $1.8 billion per year. And out of the 4,000 participants that were surveyed through the Mayo Clinic sites, approximately 15% said they had to miss work or cut back in hours because of the menopause symptoms. And now, if you look at the next two boxes, box 3 and 4, this captures highlights from two surveys that were conducted last year by Bank of America in partnership with the National Menopause Foundation. And it really identified a large disconnect between employers and women when it comes to menopause. And you'll see here, 76% of HR benefits managers said they really felt like they discussed menopause-related issues with employees. But then on the flip side, 3% of the women employees said that they never talked about these issues with HR. And then the last box, again, is from this same survey. 58% of the women surveyed in that Bank of America National Menopause Foundation collaboration said that they felt uncomfortable talking about menopause in the workplace, which, no surprise, like I said, yes, we are opening the conversation, but there is stigma around this. And quite frankly, I'd say especially in the workplace. So we have some work to do, but that's our opportunity. Next slide, please. Okay, so this is a deeper dive into that Mayo study that I was talking about on this side of the slide. And like I said, really interesting, a really exciting publication that has really come to the forefront with all of our key external experts and our top leaders in the field in this menopause and midlife women's health. And they identified an association between adverse work outcomes and menopause symptoms. And the menopause, so let me start here. This was, again, published Mayo Clinic Proceedings in April of 23, largest study to date examining this impact of menopause symptoms, and greater than 4,400 women, and their ages were that 45 to 60, right in the prime time, in employment, receiving primary care at one of those 4 Mayo clinical sites. and they were identified as having moderate menopause symptom burden. So over 13% of the women reported greater than or equal to one adverse work outcome due to menopause symptoms. So what were the adverse work outcomes? So they could have been anything from missed days within the last year of work, cutting down on hours, remember, due to menopause symptoms in the last 6 months, being laid off or fired was another one within the last 6 months, and retired, changing jobs, or quitting. And women in the highest, so menopause rating scale is what they use. The higher the menopause rating scale, the greater menopause symptom burden. So if you look at this, women in the highest menopause rating scale, or MRS quartile, were 15.6 times more likely to report one of these adverse work outcomes due to menopause symptoms than those, of course, in the lowest quartile. And this this study has several other things highlighted here, and you can really focus in on it if you'd like and pull it up, because it is quite impactful, the entire publication. And then over to the right, I wanted to highlight this. So this is another study. It was in 2010, US National Health and Wellness Survey. And they also examined the impact of severity of vasomotor symptoms due to menopause. So this was specifically zooming in just on VMS. Remember, the Mayo study was including VMS, but all menopausal symptoms. And again, over 3,000 women, ages 40 to 75. And similar, so presenteeism and overall work impairment were significantly higher in the women with severe vasomotor symptoms than moderate or mild VMS. And you can see in the bar graphs kind of separated out there. And what was interesting to me is that this study was in 2010. So think about that. That was 14 years ago, and I'm not sure we did much about it at that time, or we moved forward or progressed much. But that's okay. At least now we have several other studies in the works now examining these symptoms on work productivity, and of course the latest Mayo study as well. And I really think, when we pull all of this together, right? We pull together just this overview of menopause, how it affects individuals, the effect on work and workplace and economic impact. I think we really start to see that this is not only a societal issue, but also a health equity issue. And as I mentioned, I feel passionate about, and I think this is where a very meaningful opportunity exists for all of us, and a place where we can really move the needle in perhaps starting with elevating the conversation, generating solutions collectively, and facilitating access to high quality evidence-based care, and supporting these women, and making sure that we're collectively supporting women in midlife to prevent them from leaving the workforce. Because remember, this is the fastest growing work demographic to date. And Teresa, I think we're going to stop there, and let's have a discussion and kind of open up. I think you have another questions or discussions, hopefully.
Dr. Mancuso, that was wonderful. Here we go. Teresa, let's hold off on the Slido for a moment.
Mm-hmm.
Thanks. And yeah, thank you. So much to consider with what you've presented. And I think about, well, what I've experienced through menopause, but then also as an employer, as a manager, and situations where employees were comfortable to come to me, and they didn't say, hey, I'm experiencing menopause, this is what's going on, but
right.
But they did share, and I had a woman, I was managing a fine jewelry business. So retail, you work 7 days a week, all different hours. And she said, hey, I have restless leg syndrome, and I'm on medication for this. And when you work me to close, or even when I do, a mid shift and then you have me come in the next morning for opening, there's not enough time for me to recover from taking my medicine. I can't sleep without it. I have to take my medicine, but I'm so groggy in the morning. It's very, very challenging for me to get myself up and out. She was never late for work, but she was just not, she said, I'm not functioning well. So I was able to, make adjustments to her schedule. And she was quite grateful and became more productive too. And so that was wonderful. And, but how often does someone get to have that conversation
Right.
with their manager, right? It's just one accommodation, one area of being flexible with a person, right? That
really changed her, impacted her. Yeah.
Yeah. But and I think about what I experienced with, and I experienced hot flashes. I'm sure I wasn't. I never took anything for it. It wasn't severe, but along with that, I had memory loss in that I couldn't remember my words. So I'd be in the middle of a sentence. And I'm like, oh my God, that next word, it's there. I know the word I want. I can almost grasp it in my brain and bring it forward, but it just wasn't coming out of my mouth. And so many embarrassing moments of being in conversations and at work, right? Trying to have an intelligent conversation and going, I forgot my word.
Right.
And yeah, so yeah, there are women out there who I'm sure have experienced similar things and perhaps aren't able to laugh about it, right? And get others to laugh with them through it, right? It just becomes a tremendous embarrassment, and like you said, they make changes in their jobs to accommodate their experience.
Yeah, you're right. And so many don't, I mean, there's so many things we could discuss here, but so many just don't understand the impact or the effects or the associations with some aspects of physical health. Like we said, like you're saying, cognitive function, they just feel like they're going crazy or something's wrong or they're overtired, which they probably are. But there's other aspects, of cerebral vascular health, just to name one thing, and so it's like, oh gosh, if we start talking about it just in our circles, let alone in the greater workforce circle, so to speak, at least we'll start to educate people. They'll be more open to it, understand, oh wait, there's things I can do perhaps, or maybe there's changes I can make, and I'm not losing my mind. That's the other thing.
Well, that's it. Well, I do recall, like, as we're talking about this, I do recall thinking, am I at risk for early Alzheimer's? Like, what's going on here? This is, yeah. This
Right.
very odd.
And that's the last thing we want anyone to,
Yeah, to be in a panic. So, seeking care, knowing. So I will tell you that I never had a doctor when I was going through this ask me about it, prompt for any information. How do you find an OB-GYN that is going to be an expert in this area?
Yeah, great question. So I have to say, I know I'm an OB-GYN and biased to that, and I'll address that in a second. But also, just want to mention there are healthcare providers that are family practice, internal med, even endocrinology, are family med NPs, PAs that are very educated on this too. It's not just OB-GYNs, and sometimes it's not the OB-GYN, But there are different specialties or, like I said, physician or MPPAs that really, I want to be fair to that and say that because they really are providing excellent care for women in midlife. But now we're noticing, okay, there has been a lack of training in this space. We're working on that. I know the Menopause Society is definitely working on that. ACOG, many huge international thought leaders are on educating healthcare practitioners more, right? Either resident med students, residents, or attending physicians on proper assessment, listening, and treatment in this space. But that being said, as we're working on that, we do know that there is established network of evidence-based, high-quality practitioners that are menopause certified specialists through the Menopause Society. It was known as North American Menopause Society. They've recently changed their name and rebranded, but it's TMS, the Menopause Society, and they do have a certification for healthcare providers, healthcare practitioners to become menopause certified specialists or practitioners. So that's an excellent place to start. Some of them provide in-person care. There's several of them that truly do provide high quality, like I said, evidence-based care in a telemed setting as well. So just, wanted to mention that, but I always recommend, yes, many specialties, many different types of physicians can treat this, but right now we do know that group of physicians are highly specialized, highly dedicated, and certified. And we're hoping the number expands and expands
Yes.
for,
that would be nice. We would like
yeah.
that.
Yeah.
And we did put in the chat a link to
Oh, nice. Thank you.
NAMS. I thought I just saw it. Now I'm not seeing it.
I still call it NAMS. I'm having trouble with TMS, but I'll get there. We'll get there.
Yeah. So we have some questions. So wonderful. Keep them coming in. Thank you so much. As a plan sponsor, what types of benefit coverage are key to supporting our population and be successful at work? And what are key steps to engaging this workforce and changing the conversation?
Nice. Okay, let me see. I don't think I can. Let's see. Are you guys going to take some of this?
So I can. So
I know. I think some of it I can.
I think some of it you're a little limited, right? In how
I
you
am,
can
even though I
respond.
would.
So I'm happy to say some things for plan
too.
sponsors to consider, right? Certainly, what's on formulary. So there is medication out there for women to take, hormonal, non-hormonal, that is very effective for hot flashes. I don't recall it being in your slide, but there are women who lose bladder control during menopause, correct?
Mm-hmm.
And so looking at that and what's potential for coverage in that area. Employee resource groups, giving people a place to just talk about this and share their experiences. And women, we learn from each other all the time. So providing that safe space. And I think
that's exactly, that's something I can definitely speak about, that I think that's a huge start, and just really, I know maybe it sounds cliche, but really, you guys, we're starting from ground zero. Think of the fertility space, think of the maternity space, the postpartum breastfeeding, and now we're talking about it. And we started there. We started kind of ground zero, but opening the doors. But you were 100% correct. Opening the conversation, starting with your resource groups to have them kind of kick it off, right? And just starting that conversation, like, hey, we can start to talk about it, provide an open space and support. And then I guess I can mention one I get on. I love it so much I can't stop. But and then it's things I think like I was saying of providing or saying, hey, we're looking into, or eventually, making sure that our employees and their families have access to, like I was saying, high quality, evidence-based um, PCPs, OBs, HCPs, that are really specialized in this field. However that may look, or whatever that may be to that particular employer. I know you all know more about this than I do, but this is something that's near and dear to me, and I love this space. And I think, like I said, telehealth with these certified menopause specialists? Is it live visits where you're saying, hey, these are, even just uncovering that such things exist, right? And then helping them gain access to such practitioners. Because, and remember a couple things too, this requires, I truly believe, assessment and proper management of midlife women's health and menopause requires really a multimodal and holistic approach, right? So let's not lose sight of that. And again, it's not just words, and it's not just elementary. They not only need, what I said, access to providers, and to talk about it, but they also need, okay, nutrition support, exercise. Like, hey, I'm sure most employers have access to a great, hopefully, exercise program or of some sort, lifestyle modification type. Yeah. And remember, and mental health, access to great mental health providers. This is all encompassed into addressing midlife women's health. It's not just getting into the HCP, but it's the HCP and also all of these other ancillary services to provide kind of a holistic approach. And I think if they approach it in that way, I think it would really, it resonates with people in this life stage.
Right? Yeah.
Just getting there, just went there, just getting there. And there's so many other avenues I think that you all probably know of, or maybe not. But other people can probably comment on this too. But there are menopause health retreats that are 1 hour, 4 hour, 5 hour, whatever, for different employers and their employees to kind of just open that conversation and educate them on, okay, this is the impact, this is what to expect, and here's some things you can do about it. You know what I mean? So it kind of takes it, it's still in the hands of the employer, and the employer is providing it to employees, but they're not having to conduct this themselves. There's many of these throughout the nation now. Yeah.
That's wonderful. Yeah. Thank you. So what have been some successful ways to persuade leadership to collectively address and attend to aging women's needs? Have you witnessed that in your travels of leaders within organizations who've really embraced open
To
discussion?
persuade leadership, is that it just cut out for, yeah, leadership to collectively address?
Yes. Collectively address and attend to aging women's needs.
Yeah, that's a good one. I'd love to hear what you have to say on that as well. But
I'd like to say that I have a compelling story, but I haven't heard anyone come forward yet and say, "Oh my God, my CEO said, do we need to pause? Are you or
I know. I will tell you a couple things that really surprised me when I've been kind of, talking about this and kind of focusing on workplace, is that many I'd say senior I'd say senior leaders, I think it definitely is. It's not I'm not saying it's the CEO, but very high leadership have come to me or pulled me to the side, say in a talk or spontaneously, and just said, hey, can we talk about this? Tell me about some things. What do you think we could do? Do you think X, Y, or Z? Some of the things that I mentioned, or X, Y, or Z would be a good way to at least start this, because we have to do something, is what they'll say to me. Not everyone, but I was very surprised that I was even being pulled to the side by these large corporation senior leaders. And it was something that I took away from me and motivated me intensely, because I'm not sure, I did not think I would have that I would get those questions or that response. you know?
Yeah, and so, and it was a result of
Amazing.
them hearing you speak, that they came to you.
Oh, I don't, well, I don't want to
Or
say,
what was-
I know, I don't want to say it was just me. I don't think, I mean, I think it was just, there have been certain conferences or certain things I've been to where it was centered around women's health,
Okay,
you
yeah,
know?
but I think that's an important part. So as, you know, as our, you know, audience is asking, like, what, you know, kind of what works, how do we bring them together? And today, this webinar, right? That's where we're hoping that this helps to start the discussion. I think this would be a good time for us to pop up that word cloud now, Teresa, because I'd love to hear from people. What we'd like you to do is, you know, oh, tell us what steps you're starting to take, right? That you think you'll take to destigmatize menopause. But I'm gonna add, put in here, what resources do you need? So is the data that Dr. Mancuso presented today, is that compelling enough for you to take to leadership to get the conversation started? Is there more? Do you need, you know, Washington Health Alliance to create, well, actually, we did create one that you can link to from the chat. But do you need us to create resources that help to educate and get the conversation started?
Yeah, true, Denise.
And so if you okay, so we have people typing. So as
And
if you do that, as you're putting your answers in, we're gonna go
Denise, can I say one thing
sure.
that I don't want to miss? I think I hear you, and I hear the people that have come up to me, or friends that are leaders of large organizations throughout the US. Everyone's looking for, okay, thanks for the little, you know, some of the things you've told me, but what can we really do? And I have to say, I think we're all working on this right now. You know, I think it's not necessarily, you know, should, definitely won't only come from me as an OB-GYN practicing, or a member of Astellas in a pharma. I think it's everyone kind of forming working groups, getting together, you know, making sure there aren't silos in this, and we're working together to generate some solutions. And I think now is the time. And really, maybe we don't have all the answers yet, but we're getting there. We can get there, but we got to do the work now. You know, we don't. And also, the last thing, Society for Women's Health Research, and I know the Menopause Society are actively looking at this, and know that employees, of course, employers are looking for what can give us tangible things that we can do, you know, and they are working on this to provide even more support. So big organizations are, and I think all of us can too,
Yeah.
in different working groups. Yeah. And it's okay if we don't have all the answers yet, but we are going to.
Right. Well, and I think about the, you know, what you just shared with us about the vasomotor motor and how it's being linked to cardiovascular, right? That they're saying it seems to impact.
Just an association, but still, yeah. Dr. Thurston's work, yes.
Yeah, but what, you know, so what more is there for us to learn from that, right? There's an association. What does that mean? What does that mean to an employer who's, you know, working to keep their population healthy? Does that, you know, is that another thing for them to look at, or right? And we don't
I
have
love this
we don't have the
action
answers
brief.
to
I
that right
agree.
now, right?
Look at
Yeah,
this action brief. Yes, that we all perhaps can come up with. And the economic, yes, we need more economic data, which we have. I think. I know.
Working on that. So yeah, benefit coverage, education. I think that, and that speaks to the action brief, right? That people are saying we need that.
I agree.
Aging as sage elders. I love that.
I do too.
Yeah. So, and then we have some people who are saying they're going to bring this to leadership. Include women of color. Yes, absolutely.
Yes.
Absolutely. Um,
EDI impacts, love that.
identify barriers. I think there's, I'm afraid
Value of
to get
women
started
equals
on,
men.
I mean, the,
Love it.
yeah, this is great.
And what does good look like? Right. This all needs to be part of, have the data. Let's figure out the action brief, and what good looks like should be part of that, this action brief, not an executive summary, but
Yeah. More presentations. I love that. Yeah, and then we have another question of how can we change the culture at the work site to support this group of employees? My sister works in an engineering field and finds it highly challenging.
I saw that.
Yeah.
And I can't get that. I'm gonna take that with me forever, because that's a huge one that keeps sitting
It
in my
is, and
mind.
it
read
still goes
it.
back to talking about it, right? Like normalizing the conversation, and it's a natural physiological process that a woman goes through. So is it,
And it's gonna have to be some substantial items and from leadership, like we're discussing, to really kind of move that needle.
yeah.
You're right.
So
Okay, well, I think we have work to do.
we have work to do. We do. And we knew that coming into this, right? It's
Oh yeah.
yeah. But this has been fabulous, and really appreciate all of you participating and submitting your questions, and continuing to add to the word cloud, because we're going to use this, what you've provided to us, to determine what does moving forward look like, particularly at the Washington Health Alliance. How do we continue to help with this discussion and support our employers and union trusts with their benefits, and identifying where there are opportunities for them to do better and improve. So thank you so much,
Thank
Dr.
you. Denise.
Mancuso. This has been wonderful. And again, thank you to everyone who attended with us today.
Thank you, everyone. Only thing better would be to see all of you live. So one day.
Yes, one day. Thank you.
Thanks, everyone.